Hello and welcome to our bi-weekly Kauai Health Community Webinar with Gary Herbst. We are so glad that you joined us, and today is Thursday, June 3rd. Happy June. My name is Deborah Volison and I'm the Director of Community Engagement here at Kauai Health. So we've been doing this for over a year now, so I know that this opening gets a little old, but we want to remind you that we do post the video of this meeting on our COVID page on the Kauai Health website, and we also post it in the Community Engagement Facebook page. So we're going to cover COVID today because we are still in the pandemic, but we're also going to cover some other questions that were submitted. So welcome, Gary Herbst. It's great to see you.
Yeah, good to be seen.
Happy Thursday.
Same to you. Thanks,
Yeah.
Deb.
Yeah.
I'm so proud of you. Kauai Health. Not once did
I've been
you say
practicing.
Not once did you say Kauai Delta, and
Yeah.
So good job.
Yeah. Well, you know, I've been out a couple of times this week with community groups, and they always say, "We want you to come, but we don't want you to talk about COVID because we're sick of hearing about COVID."
Right.
But then it never fails that the conversation always steers toward COVID. And so I know that people are tired of hearing about COVID, but we just can't seem to get away from it.
No.
Our numbers are good, but as we look forward to the future and pushing on, there's still a hesitancy because we're still unsure
Sure.
of what's going on.
Yeah, which is the case of anytime there's a great deal of uncertainty about things, and obviously we've been at this now for 16 months, 15 months, somewhere in that neighborhood. Early March of 2020, and now here it is, June 3rd. So we've had more than a year of this, and we've learned a tremendous amount. But now, as we're kind of, on the downhill, hopefully, on the downhill side of this pandemic, there's still a lot to be learned. But now we're learning more about vaccinations. I was reading articles this morning. A lot of scientists now thinking maybe we won't need a booster shot after all, and trying to get a better sense of how long immunity lasts through either vaccination or having naturally contracted the virus. So that's where a lot of our discussion is now, is around the vaccination side of it, and less around the testing and things of that nature, but still a lot to learn. Yeah, no doubt about it.
Well, and it's not one of our questions, but I saw the email today that our COVID collection site is actually going to be closing down.
Yes.
And we're going to be, of course, incorporating COVID testing into our sites,
Right. And we'll talk a lot more about vaccination today because, again, we're closing the COVID collection or testing center down because the demand for testing has understandably been really plummeting as the demand for vaccination has been rising, although we also talk about that we're seeing some kind of stabilizing of vaccinations, that initial eagerness has kind of subsided a bit. So,
Okay, well, I don't want to jump ahead, so
okay.
let's go ahead and you can cover the numbers.
So I'll start at the state level, and this is as of today, so fresh off the press. We now have had statewide 3.7 million COVID positive cases that have been reported throughout the state since the beginning of the pandemic back in March of 2020. That's a 5.6% cumulative positivity rate, but as Deb was saying, the more recent observations are significantly improved from that. So the current statewide positivity rate over the last 7 days is actually 0.9%. So probably one of the lowest levels we've seen over the last 15 months. Again, 5.6% over the entire duration, but we do remember that even at the state level, there were periods that we were above 20%, so down to 0.9. But there are still positive cases that are being identified. Just yesterday, 773 statewide, although again, we were in the tens of thousands back in December of 2020, 2020 and into January of 21. We're down to just 2.1 new cases per 100,000 population, and you may recall that 2.0 is the threshold that you have to fall below in order to move into the Tier 4 yellow, the least restrictive of all of the COVID tiers under the governor's blueprint for a safer economy. There have been just over 62,000 COVID-related deaths since the beginning of the pandemic, and sadly, Californians are still succumbing to COVID-related diseases. Yesterday, we had 48 COVID-related deaths in the state of California, but we're now down to 0.05 per 100,000 population. So definitely moving in the right direction. We've done 66 million COVID-19 tests since, again, the beginning of the pandemic. And just yesterday, we did 78,000 COVID tests at the state level. So still, I would say, a relatively high amount of testing still occurring. Some of that is like our skilled nursing facility is still obligated to, by state law, to test our employees and our residents on a routine basis. So some of that continued testing is actually mandated versus others, simply wanting to get tested in case they've had an exposure. A lot of time schools and employers requiring that their employees or teachers be tested on a regular basis as well. So I would imagine we're going to continue to see some level of testing going forward. One of the really important elements to the governor's announcement a month or so ago that come June 15th, which is just 12 days from now, if our conditions look well, then he will essentially expire the Blueprint for a Safer Economy program and do completely away with the tiering and no longer the 7-day measurements of new case volume, stuff like that. But one of the important factors is the availability of hospital beds, particularly critical care beds. So as of yesterday, statewide, 1,362 COVID positive patients were actually hospitalized in a hospital somewhere in California. Only 303 of them were actually in the intensive care unit. So, and that's run pretty constant. So that's 22%, which is pretty much, we've been between that 22, 25, 26% of all COVID patients in the hospital have been in critical care units. So that's still, that means that statewide, there is an ICU availability rate right now of about 35%. So not just including COVID patients that are in the ICU, those 303, but just every day, every hospital in California has to report. It's like a 6-page statistical report, many different dimensions of a hospital's condition. When it comes to number of COVID patients, number of them that are in the ICU, adults versus pediatrics, how many are in the ED, but also occupancy, ICU occupancy. Mm-hmm. So in terms of all patients of any condition, and no matter what their disease or injury that are occupying an ICU bed right now, we have about 35% of them are available. You may recall that when the governor implemented kind of a stay-at-home order back in, again, kind of December, January, that any county whose ICU availability fell below 15% went into this stay-at-home kind of shutdown condition. So to be at 35% available statewide, which is kind of pretty much where Kauai is right now, I think that is going to be the number that the governor is looking at to be able to, June 15th, lift all of those restrictions. So that's really good information. But as of right now, we're still under the tier system, and Tulare County is still in the Tier 3 orange. Just for your information, there are still 4 counties that are in the red, Tier 2 red. 35 counties, including Tulare County, in the orange moderate, and then there are 19 counties that have now moved into the Tier 4 yellow. And in a moment I'll tell you, we are really just on the cusp of moving into that. But by the time we get into yellow, I think I read this morning that just because of the time period of doing the measurements and everything, that we won't now have an opportunity to move into yellow. Assuming that the governor follows through and June 15th, everything's rescinded, we will go from being orange to nothing. So on the vaccination front, there are now 17.5 million Californians that have been fully vaccinated and another 4.3 million that have been partially vaccinated. So almost 22 million Californians have now received at least one vaccination shot. And right now we are administering about 129,000 new doses of vaccine every day. The state has administered almost 38 million doses. I think California is standing out as one of the best performing states in the country in terms of vaccinations, so that's great. California, and this is across the entire state and would include the vaccines that Kauai is holding right now. We have 6.5 million doses of vaccine that are available to be distributed right now. So as a state, I think we're doing a great job. At the county level, I mentioned that we're in the orange moderate tier. Our 7-day positivity rate has dropped back down to 1.5%, which would put us in that Tier 4 yellow. Our health equity positivity rate is at 1.8%, so very close to the county-wide level. But that just testy little 7-day average number of new cases per 100,000 that we have to get below 2, which would be about less than 10 cases a day for us. We're hovering right there. We're at 2.2 as of Tuesday. So yesterday we only had 7 new cases. So if we were to experience just 7 a day, we would fall well below that 2.0, and we would be in what would then be the short-lived Tier 4 yellow category. There have been just shy of 50,000 COVID positive Tulare County residents since the beginning of the pandemic. Our cumulative positivity rate was almost 9%, so several points up from the statewide average. And we've had 846 deaths from COVID-related diseases since the beginning of the pandemic. And then we've also performed 564,000 tests across the county. Did 7,431 yesterday. So again, a lot of testing still occurring, but here at Kauai we definitely are seeing kind of a drop-off. So I'm going to move into vaccines, and I need to apologize to all of you. I gave you some very bad information when we last met. So I had talked about the vaccination across age categories. And so as of Monday, Tulare County has administered 171,000 doses. And then I was telling you what percentage of those doses were given to people in various age categories. And I said that 24.1% had been given to people age 65 and over. Although that's not how I said it, that's how I meant it. What I said is that 24.1% of all those people over age 65 had been vaccinated or received at least one dose. And that's not what was being reported. What was being reported, of all the vaccines that have been given, 24.1% have been given to people age 65 and older. 26.1% have been given to people age 50 to 64. And I was bothered by that. Seemed like a very low percentage of people age 65. I was mistakenly reading it that only 24.1% of that age group had received a vaccine, and that's not the case. Now, nowhere does the county actually report that, but I was able to go to a few different places in the county's website to find the population of Tulare County, and then to find it by age category, and then take the vaccination information by age category to mirror up the population that's over 65 and how many have been vaccinated. So here's my revised report to all of you. So as of yesterday, there are 45,200 Tulare County residents that are age 65 or older. And there have been 41,249 doses administered to Tulare County residents over age 65. So 91.3% of all Tulare County residents over age 65 have received at least one dose of vaccine. And I think that's phenomenal. So definitely that age category throughout the pandemic, 75% of those that were hospitalized at Kauai for COVID were over age 65. The vast majority of those who died of COVID were over age 65. So to have 91% of that population of Tulare County having received at least one dose of vaccine is just simply outstanding. With respect to the age category 50 to 64, there are 70,500 Tulare County residents that are in that age category. 63% of them have been vaccinated, so that's still a pretty high percentage. And then interestingly, 46% of the 171,000 doses that have been administered were to folks between the ages of 18 and 49. That accounts for 183,000 people. That's the single largest age category in Tulare County, and 43% of them have received at least one vaccine dose. So, and that's kind of what you'd expect, that the younger population is still more the wait and see, not certain if I'm going to get vaccinated or not. But definitely as you move up the age category and your risk factors are higher, we're seeing a higher vaccination rate. So again, I apologize for giving incorrect information a couple weeks ago, and I simply just misinterpreted the data. So now moving down.
Well, can I ask you a question?
Yeah.
So I think the last time we met, they had just approved it for kids.
Yes, for age 12 and
are
up.
we seeing a lot of that population?
Great question, and I have the answer. So again, as of Tuesday, there have been 2,751 doses given to children aged 12 to 15. So that's the bracket. So only 1.61% of the total doses that have been given so far have been given to that younger population. So, and I think definitely that's where you're going to see a lot of wait and see. I think there are going to be a lot of parents that are going to simply choose not to get their children vaccinated. We have heard repeatedly throughout the pandemic that children are less vulnerable to contracting the virus, but if they do contract it, generally their symptoms are mild to non-existent. We've seen very few children. There have been children that have been hospitalized, and sadly there have been children that have died that are younger than age 17. But I think that's where you're going to have a lot of the apprehension is in that age category. Okay, so moving on to the local level here at Kauai Health. It's continuing, and I know one of the questions is about how busy the hospital is right now. And for many unknown reasons, we are incredibly busy. We are at 93.3% occupancy across our adult units. Our 12-bed pediatric unit is still being used for both adults and children. We are able to segregate them. And as of 7:03 this morning, we did not have a single medical surgical bed open. So 237 medical surgical beds, and every single one was full with a patient. We do have a little bit of room In the ICU, we have 10 of our 41 beds were open. And in the ICCU units, we had 9 of our 54 beds open. So, and the emergency department has been just bursting at the seams over the last couple weeks. We're running, we kind of color code it, black, red, yellow, green obviously is staffing is great, and we have lots of occupancy, but black is we are solid. On a typical day over the last couple of weeks, we will have 30 or more patients that are back in the emergency department in an exam room, waiting to be admitted, waiting for a bed to open up. Many people waiting in the waiting room, being triaged from lowest severity to highest severity. But I appreciate right now that the community is probably incredibly frustrated. I'm hearing from a lot of folks that unfortunately, had to come to the emergency department and are having, waits of, 5 hours, 10 hours, as many as 20 hours. And certainly, if you're there for, a less emergent condition, which we really always encourage our community, that if it truly is not emergent, but you need to be seen, you want something taken care of, definitely urgent care centers, our clinics, your private physician. But the acuity of the patients that we're seeing right now is really off the charts. And I don't, we were struggling this morning. I was meeting with Dr. Kona Singh, and who's our medical director of the ED, Carrie Nowicki, our chief nursing officer. Are there factors that are going out there in the community, in the environment? Tulare Medical Center or Sierra View Medical Center, have they been impacted, or changes made that they're curtailing ED visits or more transfers coming in? And the only thing that really has changed recently is there was a pain management system and enterprise, and I don't know if it's LAGS, is that the name of it? It's statewide and maybe even nationwide, closed down just within the last couple of weeks, and they provided a lot of pain management, a lot of opioid management for their patients, and the fear is that many of those patients were now going to come to the emergency department to get prescriptions refilled and so forth. And we've seen some of that, but that's not really what's impacting us right now. So we always talk, hope for an outbreak of health, but unfortunately this looks like a pretty severe outbreak of illness and injury. And just this morning, we had a trauma, a stroke, a heart attack, all going on at the same time in the ED. And so I just ask folks to, I won't say be patient. This is kind of an unusual time, and also at a time that we're really struggling with staffing. We have 484 open positions right now, 107 of them registered nurses, and really statewide, the hospital industry is really experiencing a severe nursing shortage. Unfortunately, the pandemic caused a lot of nurses to leave the profession, to leave California, to move out of maybe the hospital setting into home health or physician offices, and to move around. So we're not unique in that nature, in that situation, but we're also not immune from it either. So all of these kind of things kind of colliding together to create a bit of a perfect storm right now. So, but we have a lot of hiring. We have dozens, 123 new employees that are going through onboarding right now. So we just need to, indoctrinate them and get them going, and get them, out on the floors and in the ED and working. So, so hopefully that will occur soon. From a COVID standpoint, the numbers continue to be great. We only have 9 COVID positive inpatients, only 1 in the ICU on a ventilator. We don't have any children. We did have a pediatric COVID patient earlier this week, but that patient was discharged home. So we look great from that standpoint, and we only have 14 employees that are still out on a COVID leave of absence. So, it's hard to believe that COVID is now, kind of taking a back seat to just being an incredibly busy hospital.
Yeah, that's really crazy. So the question actually was, what can you compare our census now to where it was in 2019 pre-pandemic?
Yeah.
So this is crazy without being able to pinpoint it.
Yes, and so I went back. Actually, we don't know, obviously, May and June yet of 2021. I certainly know May and June of 2019, but just looking, the surge in the census has really been up and down. I mean, we were very busy in February and March, even into April, and then we started seeing it subside. We started moving down into, we were running this 95, 97% occupancy, and then we were dipping down in the mid 80s and even got down into the low 80s, and we're feeling kind of a sense of normalcy. But then it has come roaring back in May, and now even in the first couple days in June. But if I go back to 2019, it doesn't look a whole lot different. And this has been the case that there used to be a real seasonality to, at least at Kauai, that definitely during the winter months, when the flu and other respiratory conditions hit, our census would soar. And that would last into March and sometimes early April. But then it would really drop off significantly. April, May, June, and even through the summer tended to be really slow months. That's why most of our physicians and staff take their vacations during that time, because it just was quieter. But it hasn't been that way in about 3-4 years. Certainly when Tulare Hospital closed for those couple years, we definitely felt the surge in census from that. But over the last 3-4 years, our inpatient census runs a pretty constant, 80 to 90%. There no longer is a slow period, and that's kind of what we're seeing. And again, when I went back to 2019, it was just as busy, and it does feel like deja vu all over again, as Yogi would say. But I probably 2 years ago, we were sitting here having these same conversations about patients holding in the ED and declaring the day black, and so.
Yeah, very interesting. So as I mentioned in the opening, people are really kind of COVID exhausted. They're sick of hearing about it, but yet they can't get away from it. And do you think, though, that the CDC is going to so say the governor opens everything up on June 15th,
right.
We still follow the CDC?
No,
here at the hospital?
It's actually, to my understanding, it's kind of the reverse.
Okay.
So the CDC, a national entity for the entire country, is where all the science and research is. I wouldn't say it's conducted, although a lot is conducted there, but it's kind of the warehouse, for research and science, not just on COVID, but many different viruses and diseases and so forth. And so the CDC's role in our country is based on their research and science, is to provide guidelines to us in terms of how to behave, how to protect ourselves. Doctors look to the CDC, hospitals look to the CDC. So throughout this entire pandemic, the CDC has given recommendations to us. Now, we get frustrated because they're ever changing and sometimes backpedaling on them. And, I don't think I've ever seen as much flip-flopping at the CDC as we've experienced. But then again, this is a novel, virus. But the CDC puts out guidelines. It's then up to every state to adopt their own rules for their state. So the governor, issued his executive order back in March of 2020, and he laid out, he instituted the stay at home, and then followed it with the blueprint for a safer economy. He created the tier system. That wasn't a CDC recommendation. That was The state, the governor, working with the California Department of Public Health, working with his epidemiologists and scientists, he developed the rules for the state. Then at the county level, the counties have to follow at a minimum what the state tells them. But counties are allowed to be more restrictive. They can't be less restrictive, but they can be more restrictive. And for the most part, our county has followed the state. We have always, followed the state and the county rules. We're mandated to do that. But where there weren't clear rules around masking, or particularly in a hospital, then we look to the CDC. When is it appropriate to wear an N95 mask versus a surgical mask? Other personal protective equipment. What medications? Hydroxychloroquine and remdesivir, and those are coming out of the CDC because the state and county aren't really providing guidance on that. So they're providing rules and regulations, that as a society we have to follow, and in some respects as a hospital. The governor is the one who told us, stop doing surgery on this state. You need to close down. You can't do elective surgeries anymore. So that came from the state and came from the county. Might have been a recommendation from the CDC, but again, the CDC are just recommendations. So to your question, so it's the governor who has made the decision, at least he's made the decision and announced it, that for the state of California, on June 15th, we are going to open back up the state to essentially pre-pandemic conditions. So no longer will there be any capacities for restaurants and movie theaters and churches. I don't believe there'll be any more mandated mask wearing or mandated social distancing. Probably still recommending, washing your hands frequently, trying to not touch your face, things we talked about early in the pandemic. Will the CDC, are they listening to Governor Newsom? Or will they, independent, decide that the nation can open up? Because they don't make recommendations for individual states. They make them for the entire nation. So the CDC would have to come out and say, based on hospitalizations and hospital availability, vaccination rates and everything, we think we're going to be at this. Now, one of the difficulties for hospitals is that we are held also to different rules. So there's an agency, it's actually the federal OSHA, so Occupational Safety and Health Administration, which is a federal agency, but then there are state agencies. So we have Cal OSHA, and Cal OSHA sets safety standards in the hospital. So while the governor might say no more mask wearing on June 15th, if OSHA doesn't follow suit, then we in the hospital will still have to wear masks, and we will still have to require our visitors to wear masks. We also have been told by the California Department of Public Health that they will be issuing what they call an all facilities letter, an AFL. Actually, they've been promising it now for several weeks, to tell hospitals what they now can do around visitation, around mask wearing, social distancing, allowing employees. So we were in a meeting this morning. We're all vaccinated, but we all have to still wear masks while we're in the meeting because it's required by OSHA. So yeah, a bit frustrating, and I agree with the person writing. We're all exhausted. We're exhausted in the hospital setting. We'd love to be able to stop wearing masks and get back to, our normal interaction.
Well, and lifestyles, they're getting a lot of feedback on, the members of lifestyles having to wear masks while they work out. And I'm sure the members are sick of hearing, well, we're affiliated with the hospital, so we have to follow different rules.
Yeah, and that's going to be interesting because, it is owned by the hospital, but it is not a healthcare facility. So it's, we definitely have, followed the governor's blueprint for a safer economy. So when we weren't able to open the Lifestyle Center, it's because our county was in a tier that did not allow gyms to be open. Now that didn't stop many Tulare County gyms from opening and essentially defying the governor's orders, but there really was no enforcement. But we felt as a public institution accountable to the public that we had to, kind of role model our state's position, and so that's why we kept the Lifestyle Center closed. Now that we're in the orange tier and we're allowed to open it back up, I think we're going to also look carefully at this June 15th order when it comes out, and if the governor says, gyms included don't have to wear masks anymore, don't have to socially distance, I would say it'd be very appropriate for us to adopt that. So I think, come June 15th, it could be a big, positive change for the Lifestyle Center as well.
So do you know when Lifestyles is going to open their child care center?
Monday.
Monday.
Hot off the press. I just learned earlier this morning that, we've been running a children's day camp for a very long period of time to provide a place for our staff, our nurses, our doctors, other staff to be able to, while schools were closed and daycares were closed and day camps, we ran a day camp at the Lifestyle Center, had as many as 70, 80 children, I think, coming certain times of the day and everything. And so that is winding down. I think that's ending tomorrow. And so Patrick Tazio wanted to first kind of bring a close to that before we opened the normal daycare operations. So that will happen Monday. So parents coming to work out at the gym who used to drop their children at the daycare center can do exactly that starting on Monday.
Yeah. So I don't believe the schools are going back full-time in the fall. Are they going all day? Okay, all right,
Daniel's
good.
nodding his head, yes.
Yes, because I heard there was going to be virtual and
You have the option.
You have the choice.
option.
Yeah,
Okay,
yeah.
all right.
Yeah, there will be some parents that aren't comfortable with their kids
Right.
going back to physical school, and so the schools give them that choice. But they will be offering on-site classrooms Monday through Friday. I think back to the normal full-day schedules. In fact, read just recently that maybe even having kids go longer now, and I don't know if that's to catch up for the lost learning, but Daniel's looking forward to it a little. Yeah.
8 to 8, yeah. Well, I think it's great that Kuya Delta offered that for our employees, because that really affected our employees not being able to take their kids to school.
Oh, yeah.
And, it was a big benefit for our employees, so that was fabulous. Do you know when Lifestyles is going to resume the exercise classes?
Yeah, I don't. I had really hoped, Jag is out of the office today, and I was hoping to hear from him. So I don't know yet, but I would, again, I'm thinking June 15th, it's back to normal and that's the way the governor describes it, is going back to pre-pandemic conditions. So that would mean for the Lifestyle Center returning to full normal operations and bringing back equipment that's been dispersed throughout the center to create the social distancing and everything, that can be brought back together. And so looking forward to that June 15th date.
Yeah. So you mentioned vaccines in your opening numbers, but we are getting ready to roll them out, I believe, on Monday as well at
Yes.
all of our...
We will be able to vaccinate patients at all 5 of our rural health clinics. So our newest one in Tulare, but Lindsay, Woodlake, Exeter, Dinuba. I believe we also, our family medicine center here on our downtown campus, our 2 urgent care centers on Court Street and Court Street and Demery. I believe Sequoia Prompt Care on Ben Maddox, and I also believe the Kuya Health Medical Group out on our Visalia Medical Clinic, Kuya Health Medical Group, having vaccine there as well. So.
And which one is that, Pfizer or Moderna?
We have a combination. I'd heard that like at urgent care at Demery, we were doing the Johnson & Johnson.
Okay.
But I don't know definitively, because the type of inventory can change, but generally we've had all three versions of the vaccine at our disposal.
So you can go to My Turn and you can see the type of vaccine, the facility that it's offered, and you can sign up there if you need to get the vaccine. Okay, so moving on to the future, we have been asked several times in the last couple of weeks about the seismic concerns of the hospital and whether or not SB 1953 has gone away, or if we are still looking at a 2030 deadline for our acute care facility. And then the question was asked if Kuya Health has lobbyists that are working on our behalf against that bill.
Right. So, great question. So Senate Bill 1953, which was passed, became law, came out of the state legislature, the Assembly and the Senate, signed into law by the governor. I think it was back in 1999. It was shortly after the major earthquake in 1994 that hit Northridge, caused severe damage to hospitals in that area. They actually had to evacuate patients. So it was pretty significant, and it was kind of an aha moment for the legislature, and worried about the health and safety of patients and employees and doctors, and so they passed this Senate bill that required all California hospitals to meet new, much more stringent seismic requirements by certain dates. And there were dates along the way, 2008 and 2013, 2015, but then there's the big one, the 2030. So we've actually made lots of improvements and investments in our facilities to meet the milestone requirements along the way. But the 2030 date currently requires that the Mineral King wing of our downtown hospital, which opened in 1969, it houses more than 200 of our 450 acute inpatient beds located at the Downtown Medical Center here. That facility has been categorized as a structural performance category 2. So there's SBC 1 all the way to SBC 5. If you're SBC 1 or 2, you cannot use that facility for acute inpatient care beyond 2030 unless you have retrofitted it, braced it to essentially meet the seismic performance standards, or replaced that facility. So we've been working actually since 1999 on a master plan to replace that Mineral King wing by 2030. That's why we built the 135-bed Acequia wing. That was going to be the first stage of literally building six to seven more of those Acequia wing towers over a 30-40 year period. But the cost just became absolutely unaffordable. It's estimated that it would cost more than $1.5 billion to execute that plan. So we completely started rethinking how we were going to meet the seismic standard. We are currently working with a master facility planning firm by the name of RBB Architects that has created a number of different options for us to replace those beds. We have studied deeply the idea of keeping those beds and bracing it, where our structural engineers would actually drive what they call shear walls made of steel that literally would go up and down the 4 stories of the Mineral King wing, driven deep into the ground and all the way up to the top 4th floor, and surround the building to hold it in place and not let it sway in the event of a major earthquake. That would come at a cost of about $160 million. And logistically, we'd have to close the hospital down to do it. So, and we would still have, 200-something small pie-shaped rooms that were more than 60 years old. And so we've kind of scrapped that. Although the state, we had talked to the state about, well, what if we could convince you that even without that bracing, that our facility would perform well in the event of an earthquake? Because it is so unique, our building. There were only 2 hospitals built like this in all of the state of California by the same architects. One was in Camarillo and the other here in Visalia. The hospital in Camarillo since has been torn down, and they built a new hospital to replace it. So the state has no idea how our unique facility would perform. So they would love to see us build almost a 50 to 70% scale model of the Mineral King Wing, hiring a contractor, concrete, rebar, the whole thing, like a real, and put it on a shake table to see how it would perform and see if it would collapse or not. But it would cost us, again, millions of dollars to build that scale, and we don't know how it would perform. So, and we'd still have, again, a 60-year-old building, and so we've really kind of moved away from that. So we're looking at these options. They are expensive. One is to build like an 11-story facility that we'd shell in a lot of it and just build out over time. We wouldn't have it completely filled in by 2030. Or looking at building potentially 2 smaller structures. One initially with, I think, 120 beds, which would get us about half of the Mineral King Wing, and then years down the road, past 2030, building the second tower. Trying to space it out so that it was more affordable and we could fund a majority of it using our operating funds as opposed to going to the community and asking for a bond measure. So that's currently the path we've been on, and that's what the law still requires. However, the California Hospital Association, which we are a member of, represents all of the almost 500 hospitals up and down the state, as well as many lobbyists, including lobbyists, Kuya Health. Well, technically our legal name is still the Kuya Delta Healthcare District. We are still a district hospital, a public hospital, and we are part of the District Hospital Leadership Forum, which is another association. We employ both a federal and a state lobbyist. So between that association and the California Hospital Association, they've been lobbying the legislature and the governor to at a minimum, extend the deadline under Senate Bill 1953 from 2030 to 2037. So to give us 7 additional years, which could work for us. It allows us to not have to infill a big tower or build that second tower till somewhere down the road. But probably more importantly, they are actually asking the legislature and the governor to completely rethink Senate Bill 1953. Particularly in light of the pandemic and what it's done to California hospitals. It has had, California hospitals have lost more than $20 billion throughout this pandemic. Kaufman Hall just recently did a report for CHA that shows more than 50% of hospitals in California are now deeply in the red. And they're predicting that even in the coming year, post-pandemic somewhat, the California hospitals will lose another $6 billion in money. So it was already estimated to be compliant with Senate Bill 1953, which only 40% of hospitals in California are, that it would cost more than $150 billion to comply. And there's no funding coming from either the state or the federal government. Hospitals have to fund this entirely on their own. So what they're trying to convince the state is to shift away from having seismically compliant buildings to being able to demonstrate that in the event of a major earthquake, that you could still provide emergency care to your community, that you would still be able to operate emergency department rooms, surgery. You do have inpatient beds. You could make arrangements like at the Visalia Convention Center or the Marriott, to commandeer, I guess, to turn that into beds. And we have that ability. We have our entire emergency department is in seismically compliant space. We have hundreds of beds in seismically compliant space. We have many operating rooms in seismically compliant space. We have, alternative points to provide inpatient care. So that's what everybody is pursuing right now, is that if a hospital like us, particularly one who's in a low seismic area, can demonstrate that they can provide this emergency care in the event of a major earthquake, then we actually wouldn't have to make any changes to the Mineral King Wing. And that would provide huge relief to us. Mm-hmm. Now, at the same time, we do want to modernize. Right. It is an old building, and I know our patients get very frustrated. The beds are up against the wall, it's crowded with equipment and people, and so we do want to replace. We want to build more beds like the Asikwe Wing, but we want to be able to do it on a longer time frame in more incremental steps where Kauai, through its resources, issuing tax-exempt revenue bonds, using cash reserve, operations, philanthropy, and only going to the community for a small portion. Like the Asikwe Wing cost almost $200 million to build. The community supported us with Measure M, a general obligation bond for $51 million. The other $149 million was paid for entirely by Kauai. We issued 30-year bonds that we pay the bondholders back out of our operations. Mm-hmm. We used our cash reserves, and so that's ideally what we would like to do, but again, to do it more slowly, more incrementally, more affordably, mm-hmm. In the future. So the good thing about the pandemic is it has put a bright light on Senate Bill 1953 and what California hospitals, the condition that we're in right now, and to lay on top this unfunded, mm-hmm. huge, financial obligation will be crippling to the California hospital industry. I've spoken, the CEO at Madera Community Hospital. They're not doing any master planning right now. They've already concluded that if they had to replace their hospital, which is not seismic compliant, they can't afford it and they will just close. And their community will go to Fresno for their care, which is sad. I mean, mm-hmm. Madera Community Hospital has been a part of their community for decades, mm-hmm. And it's a good hospital. It's a small hospital, but it's a busy hospital and mm-hmm. plays an important role in that community. So, but the legislatures, they're listening. I've had the opportunity to speak to Devin Mathis, Joaquin Arambula, who is the assemblyman out of Fresno. I think he's the chair of the healthcare subcommittee, and myself and a number of hospital CEOs in the Valley had the opportunity to talk to him about that. He invited me to write a white paper so that he could use in the assembly, and kind of told our story and who we were and the population we serve and the attempts we've made, to replace mm-hmm. the hospital. So hopefully that gains some traction. Mm-hmm. But that's one of the frustrating parts is, that 2030 deadline is still there, and it's 2021. Right. It's only 9 years away, and right. we have to pull the trigger pretty quickly if we're going to have anything compliant by then. But there's also this uncertainty, and do we pull the trigger prematurely? And 2 years from now, we learn, never mind.
Right.
Yeah.
So when are you expecting a decision?
By the state?
So say they extend the deadline. When will they make that decision?
I think we will hear that within the year. Will we hear it by the end of calendar year 21? I don't know that. The wheels of the California legislature grind slowly.
Right.
CHA has made it one of its top priorities. Mm-hmm. Carmela Coyle, the president of the California Hospital Association, has made it one of her top priorities. The governor said it's one of his top priorities. So that's probably the most promising,
Then he should give us money.
Yes,
right?
I agree.
He should give us
He's
money.
sitting on a $75 billion surplus right now, and unfortunately, there is no indication that any of that will be directed to hospitals. And yet we know, to have lost $20 billion this last year. And, we're trying to recover from that. We had a good March, didn't have such a good April, don't know what May results look like yet, and we're putting our budget together for next year, and it's going to be another skinny year. We budgeted no margin for this year. We probably will budget for a positive margin, but it's going to be certainly a small one, and that's okay. We're going to chalk up next year as to a recovery year. But hospitals to stay healthy and in business and be able to reinvest in their organizations need to consistently produce an operating margin somewhere between 3 and 5% every year. So there have been years, certainly pre-pandemic, where we were hitting 2.5 to 3.5% margins, which, given our payer mix, and that's actually pretty outstanding. But it's going to take us some time to get back to that level.
Yeah. Interesting. Yeah. 2030 seems so far away, but not really.
No.
Not really. Not at all. Okay, so we have just a few minutes left. So can we give everybody an update on the ED and why it still hasn't opened?
Yeah, so Zone 5, the ED expansion into the east parking lot that adds 24 new exam rooms and 100-plus chair waiting room. We've been waiting on the state. We're still waiting on the state. Last week, we submitted a staffing plan to them, which was something that they were concerned about. And they understandably concerned. As I mentioned, we're running lean right now. We have 480 something open positions, and many of those in the emergency department. So they were understandably concerned that you open up a new 24-bed unit. How are you going to staff that? Well, so it's taken some time to help them understand that it doesn't necessarily mean that we're going to have a lot more patients. Although we hope that the wait time in the waiting room will be shorter, which means patients will get back sooner, which does mean there's more patients in the ED than there were before. So we have presented them what we think is a very solid, supportable, executable staffing plan of physicians and advanced practice providers, residents, nurses, techs, and so forth. So that all went into them last week, and we're just waiting to hear. Carrie Nowesky, again, our chief nursing officer who oversees the ED, she and I spoke earlier this morning. She's reaching out to the director of the California Department of Public Health field office. So we're overseen by the Bakersfield field office. We used to be overseen by the Fresno field office, where I think we got much prompter service, but we've been with Bakersfield for many years, and so we're going to prompt them to see, what's the holdup. Is there any additional information they need? Because we're anxious to get it open.
Okay, so a quick chat. Is there any news on the new Nepal variant of COVID-19?
Yeah, I did hear we're not allowed to call them by country anymore. I don't know if you saw that. Yeah, it's no longer the United Kingdom or South Africa or Brazil. We're now using the Greek alphabet: alpha, beta, delta, gamma. There's a whole table that I don't know if the CDC or the World Health Organization, but so Nepal, India, right?
Right.
Yes, I don't know what.
You don't know what?
I don't know what Greek name it's supposed to have, but no, we do. What I've heard is it definitely has leapt to other countries at this point. India is still suffering terribly. I know that the administration is working, I don't know if it's with the WHO or other organizations, maybe perhaps the United Nations, to provide vaccine that we have to other countries that have been hard hit and are having difficulty getting access. But also everything I'm reading is that scientists believe that particularly the Moderna and Pfizer vaccines that are very effective at dealing with the variants, that they have no reason to believe that they won't be just as effective in preventing, again, remember, preventing serious illness or hospitalization, although more and more it seems now they're actually preventing you from contracting the virus. and if you do, preventing you from transmitting it. So these vaccines are turning out to be even better than we had originally hoped. So I feel very encouraged. I don't know if I'd say I feel very confident, but yeah, by all indications, they should be just as effective against the variants, including the Nepal variant.
Okay. Well, fabulous. Well, Gary, our time is up. It's 1 o'clock, so I'm going to let you close it out with some inspiration.
Thanks, Deb. Yeah, wow, time flies fast, huh? Well, just thank you again to all of you. I hope you all enjoyed a great Memorial Day, celebrating and honoring those servicemen and women that gave the ultimate sacrifice for our country. We are incredibly grateful to them here at Kauai Health. We have many servicemen and women that work here actively or in the or not actively, but in the reserves, and pretty much all of us at some point in our family, have somebody that served in the military. So just take a moment to thank them again. And thank you to all of you for tuning in here every couple weeks with your great questions and staying engaged with us. And the numbers continue to look good, and that's very positive. We were kind of just talking, though, I wish there was a moment where we could just stop, and pause to celebrate all of the incredible work that's been done by our healthcare workers here, our team, who are exhausted. But it seems like, it's the next day. It's COVID now has really subsided. It's become just a part of our normal operations. But folks they're right back in it. And again, it just makes you incredibly proud of them and just amazed how, those people that are working in the emergency department and just what they were dealing with, and, but that's what they do. That's just who they are. And it just gives you a much greater appreciation. And I appreciate all of you who have made the commitment and the sacrifice of your time to really understand and appreciate who our organization is, and to be able to get out there and share that perspective and that insight. So thank you for doing that, and thanks again for tuning in, and we'll see you in a couple weeks. Try to stay cool and keep safe and healthy.